Hi, my name is Jayla Bell. I'm a student nurse here at South Alabama, and I'll be performing my medication administration checkoff video. Here's my ID. Okay. I just want to show you I am fully in uniform. I don't have any jewelry or anything on. Hair is up, and I do also have both shoes on as well. I'm just going to scan the room for now. Starting off with my actual supplies, I just have my MAR and my order form, and then the rest of my supplies here. Now scanning the room. There's nothing on the walls, and I am the only person in here. Okay. Now we can go ahead and get started. So first, when you're in the medication room, you make sure the door is completely closed. You also want to make sure you don't answer any phone calls. You want to limit conversations to other colleagues to important information only. And you also want to make sure you follow your hospital's no interruption zone policy. So we're going to go ahead and get started. So first I'm just going to compare my patient's order form with their MAR. Alright, so on the order form it does say Jaguar J. Jones. MAR, Jaguar J. Jones. He was born 8/25/63 on the order form. On the MAR, 8/25/63. His MR number is 4176352. On the MAR, 4176352. On his order form, he is allergic to penicillin. And also on the MAR, I do see he's allergic to penicillin. For the medication, on the order form, it does say I'll be giving him Novolin R, regular insulin. Also on the MAR, Novolin R, regular insulin. It will be given 10 units subcutaneously on the order form. Also 10 units subcutaneously on the MAR. And I'll be giving this to Mr. Jones 30 minutes before meals according to his order form, and also 30 minutes before meals on his MAR. Now that those match up, I'm just going to go ahead and put the order form to the side, and we're just going to focus on my patient's MAR for the rest of the checkoff. Now I'll just do hand hygiene. So now I'm going to start my first check for 7 rights, starting off with the right patient. So again, Jaguar J. Jones, he was born 8/25/1963. His MR number is 4176352. And I do see he's allergic to penicillin. So we do have the correct patient. For the right medication, we'll be giving Mr. Jones Novolin R, regular insulin. So I'm going to go ahead and find that. Novolin R, regular insulin, and it does match with his MAR. I see the expiration date is December 1st, 2025, so we're okay to administer. Just going to show y'all. This is the right medication. Okay. For the right route, we'll be given this subcutaneously. And I do have the right syringe and needle for that, and this is a 1/2 ml insulin syringe. For the right dose, we'll be giving Mr. Jones 10 units of insulin, and I know this because the vial of insulin, again the correct medication, is measured in 100 units per milliliter, and the correct syringe and needle is measured in 50 units per 1/2 milliliter. So when doing calculations, I would still draw back 10 units in that specific syringe. And also when doing calculations, you want to check with another nurse if indicated. So for the right time, we'll be giving Mr. Jones the insulin 30 minutes before meals, and he is about to eat. So we're okay to administer this. For indication, Mr. Jones does need his insulin because he's about to eat again. And he needs his blood sugar levels regulated. For the right documentation, all elements of a legal prescription are included. So that completes my first check of 7 rights. Now I'm just going to go ahead and draw back those 10 units of insulin in my syringe. I'm going to do hand hygiene one more time just to be safe. First, I'm going to start by cleaning my vial, an alcohol pad. Again, this is the correct medication. Alright, I'm going to go ahead and show you this is also the correct syringe and needle. Open this up. First, I'm going to draw back 10 units of air. already, so I do have that 10 units of air in there. Y'all can see that. Okay. I'm gonna take off the top. I'm just gonna push that air in. Now we're going to actually draw back 10 units of insulin, making sure there aren't any air bubbles. Get these little air bubbles out. Okay, now I'm just going to scoop the top back on for safety. Now I can show y'all I do have 10 units of insulin in here. Hopefully y'all can see. All right, so now I will begin my second check of 7 rights before I move on to my patient's room. All right, again, starting off with the right patient, we have Jaguar J. Jones. He was born 8/25/1963. His MR number is 4176352. And I do see he is allergic to penicillin. So we do have the right patient. For medication, it does say I'll be giving him Novolin R regular insulin. Novolin R regular insulin. Show y'all that one more time. Right medication. Okay. I'll be giving it to him subcutaneously for the right route and for the right dose, 10 units. And in this syringe, this is the correct syringe and needle to give subcutaneously. And I do have 10 units of that Novolin R regular insulin in here. Okay, for the right time, I will be giving it 30 minutes before his next meal, and he is about to receive his next one, so we're okay to administer. For indication, again, he's about to eat, so Mr. Jones does need his blood sugar levels regulated, and that is what insulin does. For the right documentation, all elements of a legal prescription are included. So that completes my second check of the 7 rights. Now I'm just going to go ahead and make a label for my syringe before we move into Mr. Jones's room. I'm just going to take a piece of tape here, and on this piece of tape, I'm just going to write my patient's name. So we have Jaguar J. Jones. And I'm going to write the medication, which is Novolin R regular insulin. And then I'm also going to write the dose, which is 10 units. I'm just going to show y'all my label so y'all can see. Okay. I'm just going to take this piece of tape and just wrap it around my syringe so I can know exactly what is in here. Alrighty. Now we are ready to move into the patient's room. So I'm just going to move everything to the side so y'all can see everything. Alright, so now I'm in my patient's room for one knock. And I will enter, do hand hygiene, introduce myself. Hey, Mr. Jones, my name is Jayla Bell. I'm a student nurse at the University of South Alabama, and today I will be giving you your insulin. But before we do that, I just want to go ahead and start my third check of 7 rights. Make sure I identify you correctly and make sure everything is still correct, all right? So for the right patient, we do have Jaguar J. Jones, and on his band it does say Jaguar J. Jones. For his date of birth, it does say 8/25/63. 8/25/63. For the MR number, 4176352. 4176352. And on his MR, it also says he's allergic to penicillin. And I do see that he has an allergy band that does say penicillin. All right, Mr. Jones, are there any other allergies I need to know about? No? Alrighty. So before we get started, I'm just going to raise your bed to a working height. And then I'll also put down your side rails. And before I actually give you your injection, I would assess your vital signs. So I'm just going to go ahead and do that now. All right, your vital signs are good. Everything looks fine. So we can continue. All right, so just gonna do hand hygiene one more time, and I'm going to finish my third check of the 7 rights. So now we're going to do the right medication. It does say Novolin R, regular insulin. Novolin R, regular insulin. For the right route, I'll be giving it subcutaneously, and I do have the correct syringe and needle for that. For the right dose, it does say 10 units, and I do have 10 units of that insulin in this syringe. For the right time, I'll be giving Mr. Jones his insulin 30 minutes before his next meal, and he's about to eat again, so we're good to give it. For the right indication, Mr. Jones is receiving his insulin before his next meal, so his blood sugar levels can be regulated. And as far as documentation, all elements of a legal prescription are included. Again, hand hygiene one more time, just to be safe. And I'm going to go ahead and put on my clean gloves. Alrighty, Mr. Jones, this is going to be really fast. Just going to be a little pinch and a small poke. And I'm going to be out your way. I'm going to place my goggles on there too. Right. So before I get started, I just want to assess Mr. Jones' skin, make sure there aren't any bruises or lesions or anything. And his skin does look okay. I don't see either of those, so we're good to go. So first I'm going to clean his skin with another new alcohol pad. And I'm going to clean it from the center, moving outwards. Alright, I'm just going to lay this on the side here. Okay, now I'm going to take my needle. Put that down. Alright, Mr. Jones, I'm going to go ahead and pinch your skin. Like so, since this is subcutaneous, and I will be inserting this needle 45 to a 90-degree angle again since it's subcutaneous. 3, 2, 1. Alrighty. Go ahead and inject that. Alright, good job, Mr. Jones. You did a great job. Just want to show y'all I am putting the needle in my sharps container along with the top. Alright, and back to Mr. Jones. After the injection, I would not aspirate because this is a subcutaneous injection, but I will add a little pressure with the alcohol pad just in case there's any like little extra bleeding or anything, just for a couple of seconds. All right, Mr. Jones, you did a great job. I am done. Now that I have finished the procedure, I would just wait here with Mr. Jones for a couple more minutes, make sure he doesn't have any allergic reactions to the medicine. And Mr. Jones, you seem to be doing fine. I don't see any allergic reactions. Now I would just hand hygiene again. I would also go back and document the procedure on his MAR, and I would document exactly like what I did during the procedure and also how my patient tolerated that procedure. And again, Mr. Jones did really well. And then I would also come back to assess Mr. Jones, make sure everything is still going well as indicated. So, all right, that will be the end of my video.